All right, I see a number of our participants joining us today, so I want to thank everybody for joining us for today's webinar and for spending the next 45, 50 minutes or even hour with us to talk about a really important subject and one that we've been working on for several years on paid family and medical leave. We have a terrific panel with us today, and we're going to get started in just a moment as everyone joins us. All right, well, let's go ahead and get started. Thank you for joining us today for our webinar. The time is now, paid family and medical leave for all. A few housekeeping items before we begin. Everyone is on mute throughout the duration of the presentation. And if you have any technical issues with your video or audio or just using Zoom in general today, please use the chat function on your Zoom toolbar. We also have the opportunity, and you'll see the agenda in just a moment, for a question and answer session. And we'll ask you multiple times throughout the next half hour to 40 minutes to pose any of your questions in the Q&A. So please use chat for technical issues and the Q&A box for the questions that you have for our speakers and panelists. We are recording this webinar, and you will receive a recording link at the end of the webinar that you can share with colleagues. And for individuals that registered or have to leave early, you will get the link to the webinar as well. And I just want to mention, we'll mention this at the end also, we do have a survey that pops up as you close out of our webinar today, and we really appreciate the feedback that we get from these surveys. So please hang on a moment. We'll keep the meeting open for a little bit after the hour so that everybody has the chance to click on the survey link and can give us feedback in terms of what you liked about the webinar and opportunities for us to engage with you and provide additional topics that would be worthwhile. I'm David Shapiro. I am the program manager for HealthLinks, and HealthLinks is the signature outreach program at the Center for Health Work and Environment at the Colorado School of Public Health. We're based at the Anschutz Medical Campus, the University of Colorado Anschutz Medical Campus in Aurora, Colorado. And we are a mentoring program. We work directly with employers on their health and safety programs, and we advocate and advise on how to implement a total worker health approach in the workplace. Total worker health being the importance of focusing on both workplace health promotion as well as occupational safety. We know that when employees feel safe in the workplace, they're healthier overall, and healthy employers make safer decisions. So we're excited to have you join us today for our webinar on paid family and medical leave. And we will continue to provide information about our HealthLinks program in the follow-up emails to this webinar. So today's agenda, we have a keynote presentation. I'll be introducing our keynote speaker in just a moment. We will follow that up with a panel discussion to put some of the concepts into context that are presented. We're talking about paid family medical leave at both the local level for the state of Colorado, as well as nationally. And so keep that in mind as you're listening to the presentations. There is a connection between what is going on nationally and our state, and the individuals we have on our presentation, we're really grateful, are some of the foremost thinkers and subject matter experts on paid family and medical leave, both nationally and locally. And we do have ample time at the end for a Q&A session with all of our speakers, including our representative from industry. So be thinking of those questions and be starting to pose them in the Q&A section whenever you feel comfortable. We will make sure they get to the right panelist when the time comes for the question and answer section. So it's my honor to introduce our keynote presenter today, Vicki Szabo. Vicki is one of the nation's leading experts on gender equity and work. At New America, Szabo focuses on charting a path to winning paid family and medical leave for every working person in the United States, no matter where they live or work or what job they hold. She works closely with policymakers, advocates, researchers, and business leaders on policy design and advocacy strategies. Szabo has testified multiple times in the U.S. Congress and state legislatures, as well as in front of the 2016 Democratic Party's Platform Committee, which for the first time adopted a national paid leave program. Vicki's opinion pieces have been published at CNN.com, The Hill, New York Times, Refinery 29, and Roll Call, and her observations have been featured in hundreds of news stories, including on CBS Sunday Morning, NPR, MSNBC, and in the New York Times, Washington Post, Associated Press, and numerous other outlets. Vicki lives in Washington, D.C. with her husband, her son, and 2 cats. And thank you, Vicki, for joining us today. I'm going to turn this over to your presentation.
Great. Well, thank you so much for having me. It's great to be here. I want to give a special shout out to Jared, who I've worked with really closely over the years on helping to win all of these policies across the country as well. And thanks to you, David, and to your team for inviting me here today. So what I'm going to cover is sort of where are we as a country in terms of paid leave? Where have we been? Where are we going? What are the outcomes that we can hope for if we pass a national paid leave plan? What's happened at the state level, and what's in this for business? Because I know, employers are a big focus of this conversation on this webinar today. So we can go to the next slide. I want to first define what paid family and medical leave is, because sometimes there's confusion about paid sick time, which I know you all just won in Colorado as well as winning paid family and medical leave, and paid family and medical leave. What we're talking about here is a bucket of paid time to care for a new child, a loved one with a serious health issue, a worker's own serious health issue, a wounded service member, or somebody who has deployed, and there are family care responsibilities that arise from that. It includes all working people, ideally, especially in public policy, so full-time, part-time, and self-employed. The wages that are replaced are at least high enough for low-wage workers to be able to take leave, and for everyone to have a meaningful amount of wage replacement when they need to take time away from work for these purposes, and with employment protection so that nobody loses a job or faces retaliation for taking paid leave. That's the ideal policy. It's what a lot of states have passed. It's what we're hoping for at the federal level. We can go to the next slide. So why is this important? There have been headlines over the past several years about paid leave taking off in the private sector, about companies recognizing that it helps their bottom line when their workers have access to time and flexible workplace policies so that they can engage in family care or in personal responsibilities that they have to their households or to themselves or to their loved ones. But the reality is that access to paid leave and even frankly, access to unpaid leave in this country is quite rare. Just 56% of workers are covered by the Family and Medical Leave Act, which guarantees job protected unpaid time. Those that are disproportionately excluded, those 44% that are excluded, low wage workers, workers of color, and single parents. So many of the people who have the greatest caregiving needs and the most acute financial conditions for their households are excluded even from unpaid leave. When we look at access to paid family leave and paid short-term disability leave, which functions as paid medical leave in the US, just 20% of workers have a dedicated bank of paid family leave through their jobs. And only 42% of private sector workers have short-term temporary disability insurance through their jobs. As you can see from this graph right here, this is charting access to paid family leave according to the Bureau of Labor Statistics over the last 10 years. We have seen overall the average grow from 10% to 20%, meaning 90% didn't have in 2010 and now 80% don't have. But that access change has been very uneven. So at the top decile, you can see that access has grown between around 2017 and now. For the lowest wage workers, it's grown about 20% for the highest wage workers. It's only grown 2 percentage points for the lowest wage workers. I'll flag that tomorrow, actually, the new iteration of this data is coming out. I would expect perhaps, again, that there's a small uptick in access, but I think that is largely going to be driven by pandemic changes in how jobs are distributed and who gained jobs and who lost jobs during the pandemic. So just to highlight that. So overall, people in the US do not have paid family leave. If they do, it's highly dependent on winning the boss lottery, as we like to say, or on having a very, very high wage job or being a very sought after worker. But we know that health effects, economic effects, educational disparities, housing disparities, all of these things perpetuate on themselves when workers don't have access to paid leave to take care of a new child themselves or a loved one. We can go to the next slide. So quiz here, how many countries are like us? The answer, none. We are the only OECD country without paid leave for new moms. We're one of 5 without paid leave for new dads. We're one of 2 without personal sick or medical leave. So this is, sometimes people don't like international comparisons, but we are really doing ourselves a disservice and our families a disservice. And frankly, resources that taxpayers have to pay for other things because we don't have access to paid leave. We can go to the next slide. The costs of inaction, and I've sort of hinted at this. Women's labor force participation, it was already stagnant relative to other high wealth countries prior to the pandemic, and in fact, going back 15 years. But we're now back at 1988 levels in the United States, in large part because of the caregiving gaps and caregiving needs that women had during the pandemic, and that we have not yet resolved. And I say they haven't yet resolved, but that's part of the problem, is that we put this on individual families rather than thinking about system-wide solutions for access to paid leave, childcare, elder care, et cetera. During the pandemic, around 15% of workers left work because of caregiving and 8% left because of a personal health issue. In the before times, 23% of women, nearly a quarter of women, were back at work within 2 weeks of giving birth, in part because they didn't have access to paid leave. More than $300,000 is lost in income and retirement savings for older workers who need to take time away from work or leave work to care for an aging parent. And in fact, that figure is now more than a decade old. So I'm guessing that number is much, much higher. Around $22.5 billion is lost annually in families' wages due to inadequate paid leave. And the average family loses more than $9,500 when they need to take an unpaid leave. So we are in this moment where there is a big national conversation happening about what it is that we need to rebuild. And paid family and medical leave is absolutely one of those things. It's not just about COVID, though COVID put a fine point on all of these longstanding challenges. But as we hear about labor shortages, as we hear about the need to rejuvenate the workforce, paid leave is one pillar in rebuilding the strength that we need. People of color are also disproportionately unemployed, may have disproportionate caregiving responsibilities. This is a racial justice issue as well as a gender justice issue. We also know that the demographics of the US are changing. More than 1 in 5 adults in the US care for a child or an older adult or both. And in fact, there's about 8 million people who are caring both for a new child in their household and an older person. Caregiving responsibilities are increasing, particularly for Gen X, millennials, and Gen Z. And in addition, the number of people who are aging is much, much larger than the number of people available to care for them. So by 2050, it's estimated that there will be just 3 people available to care for every older person. Back in 2010, it was 7. So we're really in danger here if we do not address this policy of labor shortages, of businesses not being able to find workers, of workers struggling with their own health, as well as the health of their loved ones, and of increased costs that flow throughout society for healthcare expenses and human services needs and other things that could be alleviated if we had access to paid leave and other care policies. We can go to the next slide. So what are the benefits? And this is like the inverse of what I just talked about, so we can do this one quickly. Increased labor force participation and earnings. We know that when women have access to paid leave, their earnings are higher and they're more likely to be working after a child's birth or after taking care of a loved one. Greater workforce diversity and inclusion. We know that companies' bottom lines are stronger when they have a more diverse and inclusive workforce. Gender equity at home and at work. We know that when men take leave to care for a new child, they're more engaged in the lives of their children and in caregiving down the road. And some research out of Sweden actually shows that when men take leave for each additional month of leave that a man takes to care for a child, women's earnings go up by 7%. Increased health outcomes, things like breastfeeding rates, maternal health, lower rehospitalization rates for family members, less use of nursing homes, which means reduced Medicaid costs. These are all kind of the downstream effects that we see when we have access to paid leave. There's also just a new analysis out today showing also that more jobs are created and more income flows to families, not just in paid leave benefits when those benefits are created, but also in the jobs that are created and the income that comes to people because of the increased consumer demand. So it's not just a benefit for the people who are taking leave, there are follow-on effects. Businesses, higher retention rates, lower rates of turnover, fewer costs of rehiring, more productivity, higher morale. And then finally, GDP. McKinsey estimates that 2.4 trillion in GDP could be gained by correcting gender imbalances. AARP estimates 1.7 trillion could be gained by making workplaces more inclusive for family caregivers. We go to the next slide. So what do we need? We need a national paid family and medical leave program that provides access to meaningful paid leave to every working person in the United States. This would be comprehensive coverage for all of the reasons that the Family and Medical Leave Act covers. So caring for a new child, your own health condition, the health condition of a loved one, broadly defined, because we know that families aren't just parents, spouses, and children, but are often grandparents, grandchildren, siblings, in-laws, and even those who might not be related to you by blood, but are part of your family or your chosen family. And Jared has actually done incredible work at the state level, making policies inclusive for all families. Affordable to use, so making sure that benefits are meaningful to workers, making sure wage replacement is high enough so that even low wage workers can use this benefit. And that's one of the challenges we saw in some of the early paid leave states. It's a correction that's been made in paid leave states like Colorado, Washington, Massachusetts, the District of Columbia, Connecticut, and Oregon. Sustainable programmatic funding so that there's certainty. We know that this paid leave program will be around. We can make plans, workers can plan, businesses can plan, states can plan. Efficient public administration to make sure that workers are able to apply, that businesses have their questions answered, and that this system works well and people get their benefits quickly. Creating a program that employers can build upon and innovate around, and support for the private sector, companies that do want to help manage leaves and help reintegrate workers into their workforces. So you can go to the next slide. As I mentioned, states have really paved the way. There are now 9 states plus the District of Columbia that have enacted paid family and medical leave programs. 7 of those are currently in place. The others will come online between next year and 2024. These include many of the same things I just discussed. So they're comprehensive of all workers. They cover all FMLA reasons. They have an inclusive definition of families, and the newer programs have progressive wage replacement. At the state level, these are all funded through payroll deductions, either on employers, employees, or both. A small share of a worker's earnings or a company's payroll goes to provide a sustainable long-term permanent program in states. At the federal level, the sort of marker bill also included this kind of a pay for, but what we're looking at now is a program that is wrapped up into the Build Back Better Act, which would be funded through tax fairness measures rather than through a payroll tax. We can go to the next slide. So as I said, we've got this unique opportunity right now. Literally, as we speak, there are negotiations happening in Congress over the Build Back Better package and a comprehensive paid leave proposal that's within that. Just last week, or 2 weeks ago, I guess it was, the Ways and Means Committee, which is the tax writing committee and the committee that has jurisdiction over the Treasury Department and Social Security Administration and works with benefit programs like Social Security, forwarded a very strong proposal on. It passed out of committee, and it is now part of the Build Back Better Jobs and Families Reconciliation Package. It would, again, cover all workers. It would be publicly funded. It would include all of the reasons in the FMLA plus 3 days of bereavement leave. It may also include safe leave for survivors of domestic violence. It would cover up to 12 weeks. It includes progressive wage replacement so that low wage workers would get 85% of their wages and a typical worker would get about 66% up to a cap. And it has an inclusive definition of family members, as I described, so that recognizing families come in a lot of configurations and family caregiving responsibilities may vary from family to family. It includes some recognition that employers may have their own voluntary plans, and so it would reimburse employers that meet federal standards for a portion of their costs. And it would be harmonized with existing state programs, recognizing that states that led the way and maybe even offering more generous benefits should be able to continue to do that with some federal reimbursement. So we can go to the next slide. So, I've mentioned a little bit of this already, but I know in particular for this audience, you may be just wanting to know more about what is the business case for public investments in paid leave? Again, workforce diversity and inclusion for women and people of color and people with disabilities. Retention improves. Cost savings. So when companies have paid leave, revenues are found to have increased by 4.5%, and profits go up by nearly 7% per employee. The shared load. So a lot of times I'll hear from companies, we already have great policies, so why would we care about a public paid leave policy? Well, I like to, remind folks and just think about the ways in which your employees interact in their families, and the fact that you may offer great benefits to your worker, but your worker may be married to somebody who doesn't have a paid leave policy, or maybe siblings with somebody who doesn't have a paid leave policy. And what that means is that actually your employee is going to use your program as you want them to, but they're also probably going to take more time because the other people in their family who may be available to care for a loved one won't be able to do that. So, I have personal friends I'm sure many of us can think about, especially in this sandwich generation, a group of siblings who are caring for a parent that has cancer, and one of the siblings has paid leave and the others don't. So a public paid leave program would share the load across available family caregivers. Certainty and predictability. So knowing that paid leave is there, that companies can build on it, but that there is a federal baseline. And then finally, for smaller businesses, the experience in states with paid leave has been very, very positive in each of the states where this has been studied. And what smaller businesses say is that a public paid leave benefit allows them to compete with larger businesses. It creates some security and stability in the costs that they can expect, and it frees up resources for them to hire replacement workers, for example, or to pay a part-time worker to work full-time for a period of time. So there's a coalition called Small Businesses for Paid Family and Medical Leave that's got, more than 500 small businesses signed on in support of federal paid leave policy for those very reasons. We can go to the next slide. So lots of opportunities. We can talk more about this in Q&A, but if you are a business that wants to get involved in federal advocacy, there are many ways to do that, whether it's simply talking about your own policy or talking about how you've managed and thrived with a state policy, whether you want to talk about what a federal policy would do for you, whether you want to engage your employees or your consumers in advocating with policymakers and in the media, we can help plug you into that. And then, lastly, we can go to the next slide. Sorry. Just want to underscore, the US is an outlier. We've got a patchwork and it is costing us. There is a huge cost to inaction. We need a national program. It would cover more than 100 million workers and their families who don't have access to paid family leave through their job now. The market has clearly failed, as you could see from that slide. Early on, access has increased, but it's increased very slowly. We've still got 80% of workers that don't have paid family leave. And there are huge disparities by job type and by income level. A sustained, predictable investment in a public paid leave program would yield substantial returns for businesses and for workers. This is about D&I, it's about the economy. And lastly, we have a window to make this happen right now. And the work that you all may be able to do in helping to make that happen would make a huge difference for people all across the country and their loved ones. So I will end there and happy to answer questions at the right time.
Thank you so much, Vicki. I feel like each time I talk with you and Jared, who's upcoming, and Rebecca and the representatives at Boulder County, I learn new things about paid family and medical leave that I didn't know before. So I really appreciate that. And I know things are very busy in Washington, D.C. right now. So we really appreciate you spending some time with us this morning. So now let's bring the context into Colorado, because as many of you have been realizing and even talking with our program about in the next year, Colorado did pass legislation about paid family and medical leave that's going to be implemented over the next few years. And I know all of you have some questions about that. a reminder to put your Q&A, your questions for both Vicki at the national level, as well as from our panelists into the Q&A section, and we will go through those shortly. Also, I just want to let you know that the recording of this presentation, along with Vicki's slides, will be shared with you upon conclusion of this webinar as well in the next day or 2 days after the webinar. So I'm honored to introduce also our panelists today. So first we have Jared Make. Jared is Vice President at A Better Balance and a member of Better Balance's staff since 2010. Jared has worked with advocates and coalitions to draft and pass dozens of state law and local laws that guarantee paid sick leave, paid family and medical leave, and emergency leave for COVID-19 and other public health emergencies. In 2014, Jared co-founded A Better Balance's LGBTQ rights and family recognition program to advocate for the rights of LGBTQ workers, raise awareness about the diversity of family structures, and enact workplace policies that cover a range of caregiving relationships. Jared also launched A Better Balance's Defending Local Democracy project, a nationwide effort to strengthen, protect, and defend local workplace justice, racial justice, and economic justice laws. Through this effort, Jared has worked closely with cities to prevent and challenge efforts to restrict local laws that guarantee paid leave, LGBTQ non-discrimination, fair scheduling, and other work family protections. Jared graduated Phi Beta Kappa from Wesleyan University and cum laude from NYU School of Law, and he resides in Denver, Colorado. Thank you, Jared, for joining us today. I'm going to introduce our other panelists too. Rebecca Wagner. Rebecca is a benefits and analyst at Boulder County government. And Rebecca has worked at Boulder County since 1996, and exclusively as the benefits analyst since 2007. In this position, she advises over 2,000 benefited employees through their available leaves, which include short-term disability, long-term disability, and FMLA. Rebecca is the main point of contact for all employees who have leave questions and for those who are returning from a leave of absence. Since Boulder County offers several special benefits to employees, such as caregiver leave and infants at work, Rebecca manages these policies and programs as well. She provides training to new supervisors, and as ABA coordinator, she directs supervisors through the interactive process. Rebecca counsels employees on the county's self-funded benefits plans and their insurance billing issues. So thank you both, Jared and Rebecca, for joining us today. I'm going to start, Jared, with you to give us some context about what's going on or what has gone on in Colorado in relationship to paid family leave over the past few years. I know you've been deeply involved in the Colorado initiative. So let's take Vicki's terrific national presentation and provide a spotlight on what's going on in our state. Thanks, Jared.
Great, it's my pleasure. Good afternoon for those of you on the East Coast. Good morning for those of you here in Colorado. And thank you, David, for having me and hosting this program. And it's such a pleasure to present alongside Vicki, who I've worked with for more than a decade now, and Rebecca, who I'm excited to work with in the years ahead. So, as you all know from Vicki's presentation, Colorado joined 8 states and DC last November when it passed Proposition 118, establishing the country's 10th paid family and medical leave insurance law. So I'll be focusing my comments on Colorado's new law, but we'll also flag important takeaways and considerations for those of you from elsewhere. So first, Colorado underscored what polling on paid family and medical leave has shown for many years. This policy is incredibly popular, and it has deep bipartisan support. Coloradans mobilized during the early months of the pandemic to safely gather signatures for this ballot initiative to qualify, which really reflected this strong support for the policy. And then in fact, Prop 118 won statewide by 15.5 percentage points. So in addition to its bipartisan win in the November election, Prop 118 also won in urban, suburban, and rural parts of the state. In addition to huge wins in the most populous parts of Colorado, Prop 118 carried many suburban and rural counties, with wins stretching from Las Animas County in southeast Colorado to La Plata County in the southwest part of the state and Garfield County on the western slope. And the initiative also carried Weld County, a top producing agricultural area where 75% of the county is devoted to farming and raising cattle. And so as I reflect on the path that this issue has taken to become law, it's important to recognize first that advocates and policymakers have worked on paid family and medical leave in Colorado for many years, with countless stakeholder meetings involving workers and employers, far too many stories from workers on the incredible need, and a robust body of evidence in support of the policy. So in 2019, I was one of 13 individuals appointed by the legislature to a paid family and medical leave task force. And the task force was comprised of individuals with diverse backgrounds and perspectives, including employers and those with HR and insurance experience, advocates, and economists. We deliberated for 43 hours. We commissioned multiple expert reports and reviewed nearly 1,000 public comments. And despite a range of views, the task force reached broad consensus, usually with a supermajority on almost every issue examined. So in addition, the task force was required by statute to commission an actuarial study, which then clearly showed that a program like the subsequent ballot initiative approved by voters would be in fact solvent and affordable. And the actuaries even noted that this was with a confidence level much higher than the level that they noted was commonly used by the industry. So the actuarial study that supported the task force models is especially noteworthy given the many similarities between the task force's recommendations and what ultimately passed in Colorado. So for example, the initiative matched the task force recommendations on the overall model of the program, which is the same as the other statewide social insurance programs that have already been passed. The same covered purposes for leave, standards for eligibility, the wage replacement standard, coverage of self-employed workers, benefit portability, and so on. And the initiative also will provide 12 weeks of paid family and medical leave with an additional 4 weeks for workers who experience pregnancy or childbirth-related complications. A modest length of time that falls squarely within that actuarial study's analysis of benefit duration. And so just another key point I want to emphasize that Vicki discussed earlier is that publicly administered paid family and medical leave programs have specific benefits for small business. So when a worker welcomes a new baby or faces a serious illness, small business owners, as you all know, often can't afford to pay out of pocket for this amount of time off. A fact that can lead to a competitive disadvantage with larger employers that do have the resources to attract talent with paid family and medical leave policies. However, the initiative here in Colorado that passed will level the playing field and ensure that workers and small businesses can access paid family and medical leave through an affordable program, since a stable statewide risk pool keeps costs down. And then the initiative also had other provisions that support small business as well. While employers can deduct half of the premium cost from their employees' paychecks, the initiative waived the required employer side contribution for businesses with fewer than 10 employees. And even employers that are currently providing paid family and medical leave, like my organization, will benefit under this law since they can now provide similar or more generous leave and save on existing costs through the more affordable statewide program. And then the initiative also provides that employers can meet their obligations through an approved private plan that meets the law's baseline requirements, ensuring greater employer flexibility. So in short, the Colorado ballot initiative is backed by data and a tested national model. And the research shows that this program works. And as shown by the task force's expert studies, it will work here as well. And so as I wrap up, I wanted to share that the Colorado Department of Labor and Employment is hard at work on implementation and doing really excellent stakeholder engagement. And the department is currently turning its attention to initial regulations on some of the program mechanics, with more rulemaking to come in the months and year ahead. The program will begin collecting contributions on January 1st, 2023, with benefits beginning January 1st, 2024. And my organization in our Colorado office is committed to doing everything possible to support a successful launch of the program. And we've been proud to work with many workers and employers on this issue, including Good Business Colorado, an important voice on the business case for paid family and medical leave here. And employers like, those of you joining us today from Colorado will have a critical role to play in ensuring a successful implementation and launch of this program in the years ahead. So in the meantime, we're continuing at a better balance to work and to ensure that the federal government and more states, as we await federal action, follow Colorado's example and pass an inclusive, comprehensive paid family and medical leave law. And a federal program like what has been proposed by the Ways and Means Committee, which Vicki explained earlier, would be a tremendous win-win for Colorado, with the potential for reimbursement to the state and a substantial lowering of costs here, all while we continue to meet the very strong standard approved by Colorado voters. So thanks so much. I will share with David information that if you're looking for more details on the Colorado law, as well as how it compares to the other 9 programs around the country, we have a detailed chart that will be sent out with the materials, and look forward to any questions after Rebecca presents. Thanks so much.
Thank you, Jared. Appreciate your comments and your expertise on this matter in Colorado. We all are eagerly awaiting the rules and implementation points that you're talking about. I know that there's a lot of people planning for how to implement the Colorado paid leave statute. So thank you for joining us today and providing a voice to what's going on, what has historically happened, and what's going on right now. Once again, as a reminder, any questions for Jared on the Colorado leave statute, or more broadly, we see questions coming in and we're going to get to them in just a moment, but please put them in the Q&A and we will make sure they get to the right panelists or to the entire group of panelists. So, Rebecca, I want to turn this over to you. And so we've sort of gone from the national focus to our state. And now, tell us a little bit about Boulder County government's journey when it comes to paid family and medical leave. I've been interacting with members of your team for the last 6 or 7 years on your comprehensive paid caregiver leave program, and would love to hear a little bit about the program itself, how you got to where you are, and what the sort of impact has been so far in Boulder County. So, please drive us into what this looks like in a specific employer, in this case, Boulder County government.
Thank you, David, for the introduction there. So working with Boulder County, we really kind of transitioned through, we morphed into what we call a caregiver leave. Right now, our caregiver leave pays out 6 weeks at 100% salary to employees who are experiencing a range of issues, caring for loved ones that fall underneath the FEMLA regulation of spouse, parent, child underneath the age of 18. You can use, obviously, the caregiver leave for that time that coincides with FEMLA, but we've also opened it up to be more inclusive and to include a broader definition of family for those who are caring for, I lost my train of thought, aunts, uncles, nieces, nephews, cousins, close family members that don't necessarily, when I say close family members, I mean close family relation that don't fall underneath the definition of family. We also have the opportunity for employees to apply for that caregiver leave and use that for those 6 weeks. To take you back a little bit, our caregiver leave was specifically designed initially back in 2016 to just provide 4 weeks of coverage for parents who were either adoptive or new birthing parents. And that was very kind of closed-minded. We wanted to open that up a little bit. So in 2018, that's when we moved into that caregiver leave that opens a broader aspect for employees to take that time off. Along with the caregiver leave, we've also instituted Infants at Work, which allows for parents to bring their new infant into the workplace up until the point that they are mobile. We do have them set aside alternative members within their office to help them care for baby. Let's say if they're in a meeting and baby acts up, cries a little bit, there's someone else that can step in and help take care of baby for that time being that the parent can't directly take care of the child themselves. We do also have an adoption reimbursement program for adoption fees or adoption agencies that employees can apply for, and that's up to $10,000. So that's a nice way for the county to give back to their employees. And the way we see that come back is really with morale over all of our departments. Retention is a huge issue with county government, not paying as much as private sector and competing with those salaries. So to know that a parent or a family member can take off time to care for those loved ones really puts a strong foothold back into the county to have them want to stay longer. Again, retention is a huge factor for our government. And that's part of our benefit package that we overall offer to all employees. Caregiver leave is prorated based off of the employee's FTE percentage. So even employees who are only working 20 hours a week have that benefit of the 6 weeks of paid time. It's important to remember that you can see it as a cost to the county, but overall to keep employees engaged and wanting to come back after delivering a child or even after adoption, it really helps knowing that they can come back to an environment where we're welcoming all sorts of family members to come in and take advantage of that program.
Great. Thank you so much, Rebecca. I really appreciate it. One question before we open this up to the full panel. I know we've had a conversation about this. Where is Boulder County at in terms of evaluating the 12 weeks of leave and the new Colorado legislation? How do you feel like that conversation is going for Boulder County government?
I think at this point we are looking at supporting the 12 weeks of paid leave. I don't know how that's going to change our current caregiver leave program, but we are really looking honestly at having those 12 weeks of paid time because of making it more inclusive, making it more affordable for all of our staff members. And so knowing that they can take that time off and really address their family's needs really puts a lot of, it really builds on our Families First program that we're trying to establish here at the county.
Thanks, Rebecca. We've heard from a number of towns and cities, local governments as well, that are talking about, well, if the employer down the street is mandated in offering this 12 weeks of leave, it makes sense for us in order to compete for top talent and to be a workplace of an employer of choice to maintain and sustain the policy as well. And so we're starting to hear more of that narrative also. So let's start with our Q&A section. I can ask Vicki and Jared to join us back on screen here for some of the questions. And I'm going to start, Vicki, with a question that came up while you were presenting. A reminder to all of our participants that if you have any questions for myself or for the panelists, please put them in the Q&A box. So Vicki, there was a question about one of the stats you presented that revenue actually increases at companies when they have a paid leave policy. So can you tell us a little bit more about that? What that looks like in practice? That can be maybe confusing to some people.
Sure. So I don't have the exact methodology in the back of my mind right now, or at the front of my mind right now, but my guess is that it has something to do with increased retention, increased productivity, lower turnover costs, more institutional knowledge, happier employees who are serving customers in a better way, things like that. You're on mute, David.
Thank you. Jared, any comments you want to add to that particular statistic? I was thinking the same thing in terms of morale and engagement, retention, recruiting. Anything else come to mind in terms of how a company would increase revenue based on having a paid leave policy?
No, I mean, I think those are exactly the points that I would raise as well.
Great, thank you.
I have a
We've go ahead, Rebecca, please.
I have a point to add to that. The cost of losing an employee that's even been there 2 years, the cost to bring someone else in, to train them, to make them back up to that level of the employee that left is a huge offset to the county. I know from experience that when you lose a long-term employee because they are stressed out about caring for their family member, not knowing how to make ends meet when they're going on that leave, prior to us initiating that caregiver leave, it was people would just leave because they didn't know how else to do it, because they were looking for other work that could accommodate the schedule that their parent needs to receive radiation. And to bring in that caregiver leave, also flexible schedules, really contributed to retention for the county.
Great. Thank you, Rebecca. I appreciate that context in the case of Boulder County as well. And we know how much turnover and training costs when hiring new employees. So I think that does have to factor into people's decision-making here. Have a kind of a pretty a human resources specific question, and it's kind of state specific. So Jared, I'm going to ask you to reflect on this one first. So let's use this example of an employer that is headquartered in California, but may have employees that work in Ohio remotely. Have you seen any examples of how that employer handles? Would the employee have access to paid family leave because the employer is headquartered in California, or not because they're working remotely from Ohio? I don't know if this has come up at all in terms of multi-state, multinational companies, but what does this interaction look like in practice, if you don't mind sharing?
Yeah, no, it's a good question, and one I think increasingly we're seeing given the pandemic with even more remote work. So the possibility of people working across state lines, I think, has increased. And in short, well, to start with Colorado, it's something that will be addressed through rules and regulations. And to generalize, and this will depend on each state's law. Typically, and a real benefit of paid family and medical leave is that there are a lot of elements that are very similar and could be designed similarly to how unemployment insurance is already done in a state, in terms of how wages are calculated and reported and a lot of the mechanics. And typically states with paid family and medical leave laws and what, I think is something we might expect here in Colorado, but again, we'll see with the rules, is that you follow a UI unemployment insurance test in terms of where the worker is localized. So, it can be a bit technical. It certainly, as a threshold matter, it depends on where the worker is, not where the employer is based. But in a time where it may be a little less clear if a worker is based in a state, typically states have looked to the same standard for unemployment insurance with whether that worker is sufficiently connected to the state in their work. And so it's a standard that it's, again, pretty technical, but one that should be familiar to employers from how unemployment insurance is done. And paid family and medical leave tends to be done the same way.
Great. Appreciate that correlation. Vicki, anything you want to add to that? Or I appreciate the comment of where the worker lives and connected to unemployment insurance. That makes a lot of sense in my mind. I guess a follow-up to that, Jared, from a state level, is any advice for a small business that wants to implement paid FMLA, but has out-of-state employees and wants to start before the Colorado law is implemented? Is the recommendation to just start putting the policies on the books and figure out how much it's going to cost, do the analysis? I'm just curious, your thoughts about this question of, okay, we're ready to implement, we're a small business, but we may be ready to go before the Colorado law is implemented. Do you have any suggestions for that firm?
Yeah, and I mean, I think certainly it starts with looking at the costs. And again, one just huge benefit of the program and, the hope of seeing a federal bill as well is that, it does reduce costs for small employers that may struggle a bit with paying out of pocket. But I think looking at the cost and looking at the benefit, a better balance where I work. We're a small nonprofit. We have staff in New York that's covered by New York's paid family and medical leave law, and in DC covered by DC's. But I'm here and have a colleague in Colorado. We have folks in Tennessee where there is no paid family and medical leave law. And we are an example of an employer that implemented across the board for everybody, also so there is equity within the organization. But I think it does start by looking at the costs and also the savings that we talked about earlier.
Great. Well, let's talk about costs a little bit. Rebecca, are you able to share any data about, on average, cost of what the caregiver leave benefit either costs Boulder County? So there's a question about, are we able to provide an estimate of how much caregiver leave benefits cost Boulder County, and also what percentage of employees use it? I can remember from my conversations with Boulder County that you've done quite a bit of data analysis on FMLA leave in order to get to your current policy, but what sort of budget numbers are you providing to county commissioners and local officials in relationship to the cost of the program or percent of employees that use it?
I can actually pull that up for you. Give me just a second. I
Sure.
know it's going to come up as far as budgeting, but on
Awesome.
average, we have about 40 to 50 employees each year that use the caregiver leave. And that, again, that's out of 2,000 employees that we have, both full-time and hourly employees. So I will get back to you regarding our average costs on those within this chat.
Thank you.
Can I just chime in? I mean, what Rebecca's described is pretty typical. It's really interesting because, as we know, there's a large aging population, as I mentioned, and kind of fewer and fewer family caregivers, but people really think very hard before they take family care leave, or they're using it in small increments, and so they don't apply to use family care leave. And so there is a perception that it creates a huge cost and that it might be a huge burden. In reality, it's a very small portion of the universe of leaves that are taken, but for those people who need it, it is a very, very significant lifeline. So I'm actually just working with a healthcare executive right now on an op-ed that she's writing, and one of her, she is a woman in her 50s. She's never taken a paid family leave before. She's been caring for her mother over a period of years and many different conditions, and she finally reached a breaking point where, it was very clear that if she did not take paid family leave, her mother's health and her own health were going to suffer. And so this op-ed kind of talks about the journey that it took for her to take the leave that was available, but also really reflects on the fact that it's very unusual to have access to paid family leave. And I think it just puts a point on how important it is for the small share of people who need it. And that is why we need it baked into the policies that we have.
I really appreciate this conversation and that narrative. There have been so many times where an organization has told me, well, we couldn't implement paid leave because it's going to be too expensive. I still hear this today. And I think what we're finding is doing the data analysis to really find out what it costs. Okay, so we're talking about Boulder County, roughly 2,000 employees. Let's say 50 people a year are using this. That's 2.5% of the workforce, right? And so it is not going to open the floodgates of people taking this sort of leave. That's not how this works. It's more a matter of equity. People are very intentional when they take their leave. And for everyone participating on the webinar, if you're in a meeting and hear someone say, well, we could never really implement paid family leave, it would be too expensive. My hope is that you could come back and say, well, have we run the numbers? Can we check and just see, can we do some forecasting and analysis? Because oftentimes someone who has said that has not done the data analysis. And so our recommendation is let's see if we can validate that statement. It could be the case that it's very expensive. I know that when the University of Colorado implemented this leave, we had a similar conversation. And when the numbers got run, we were able to come up with a dollar figure that was manageable and reasonable for the university to incur. So let's challenge people who say this is just too expensive in the workplace. Let's see. We can never get to all of the questions on Q&A, so I appreciate all the questions coming up. A question here for Vicki. Have you seen data that shows disparities between the workers that take leave and those that don't, even when it's offered? For example, are there other things we need to do to ensure that there's equity in the leave? You were talking about, more higher income employees taking it, but I'm just curious your thoughts there.
Yeah, I'm trying. I have definitely seen data on this, but what comes to mind from that and from kind of anecdotal is that yes, sometimes people have access to paid leave, but within their workplaces, there's not a culture of leave taking. There are disincentives for taking it. You might feel that will be penalized or will be seen as less loyal or less dedicated, less worthy of a promotion than your coworkers. And this is just an example of how policy and culture really go together. So that when you have a leave, for a private company that's adopting a leave policy, what that means is you don't just put the policy in place, but you make sure that high level people are using it, that they're able to tell their stories, that they're showing that this is a normal part of working in a workplace and being a person. So famously, when Facebook instituted their parental leave policy, they had a couple of very high profile men take leave, Mark Zuckerberg, but also this other guy before that, take leave, and they promoted it and talked about it. At Deloitte, they talk a lot about, having a great leave policy and then also sharing stories on internal employee networks about the employees that take it. What I think this means at the public policy level is that you make public policy available and then you create a culture of leave taking that is internal to, but also expands beyond just an individual workplace to really change narratives around the human toll and the economic toll and the health toll of not using the leave that's available when you need it.
Thanks, Vicki. Rebecca, having any success on data?
I've enlisted, oops.
You're on mute now, but you were off.
There we go. I've enlisted a couple employees here to help me pull that information quickly. We'll see.
Yeah. Okay, we can always share it in the follow-up as well. I want to thank our panelists and presenter today. I always like to have a few minutes as wrap up here. Thank you for everyone for joining us on today's discussion. We know how important your continuing education credits are, and so please stay on the meeting. We will hold the meeting open for a few minutes after the hour so that we can make sure that the survey link pops up for you to take, which is how we can validate your attendance today and provide you continuing education credits. I want to thank Vicki Shabo, Jared Make, and Rebecca Wagner for joining us on our presentation today. Our next Health Links webinar is coming up soon, and it's going to be another really important and great topic with some fantastic subject matter experts. The topic is the impact of fatigue in the workplace or working tired. Fatigue and healthy sleep, these are things that are connected to the overall health and safety, the well-being of your team members. And so in our follow-up, you will get a link to register for this webinar, which already has a few hundred people registered for it. We're partnering with NSC, the National Safety Council, and as I mentioned, some subject matter experts about the impact of fatigue on the workplace. I think over the past year and a half, we have seen the importance of focusing on mental health and the importance of thinking about, when possible, healthy sleep and how fatigue impacts us, impacts our presenteeism. So just once again, thank you to our panelists and for everyone joining us today. A really robust discussion. There will be follow-up information that includes the recording of today's webinar, as well as resources shared by both and discussed both by Vicki and Jared. We will see if we can get some more of the data points from Boulder as well and share those out with everyone, because I know people are curious about what the cost is in implementing. You will find more information about the Colorado policy coming in the next few months with implementation starting up January 1 of 2023. And we will keep a close eye on what's happening at the federal and national level per Vicki's recommendation. So, if you want to get more involved in the paid leave conversation, feel free to respond back to any of the emails you get from us and our team, and we can connect you with state and local as well as federal advocates. And appreciate everyone joining us today. Like I said, we'll leave this open, and please take the survey upon closing the webinar. Thanks, everyone.